When a patient arrives for MR Guided Focused Ultrasound treatment, the first thing we need to do is completely shave the head. And this might sound quite dramatic, but it's really quite important because the air that is trapped by the hair follicles can prevent the ultrasound energy from getting to the right target. And therefore, the head is completely shaved. Of course, the hair will regrow, or one can wear a wig until it does. We then need to place the head in a frame. And the importance of this is that the head needs to be kept very still during treatment. Otherwise, the focus of the ultrasound won't be as precise as we need it to be. And we place a rubber diaphragm around the frame and around the head because we also need to pump cool water over the head because the skull actually absorbs some of the ultrasound energy as it's going through the skull. And we need to cool that down to prevent any injury to the skull. And then we place the individual flat on the table that is attached to the MR scanner. And the frame and the head of the patient, the top of the head of the patient, goes inside a half dome which contains hundreds of what we call ultrasound transducers. These are the generators that produce the energy that is required to create the lesion. So at the end of the day, we have a person comfortably lying down with their head securely placed in a frame within this ultrasound dome, within the bore of an MR scanner, within the hole of the MR scanner. And typically the procedure is performed with patients awake. And therefore, throughout all of this, we apply local anesthetic to attach the frame. We also give some painkillers and some anti-nausea agents, anti-sickness agents, to minimize any side effects that might happen during the therapy. It's really important that the person is awake because as we perform the therapy, we actually want to see that the tremor, if that's what we're treating, disappears and goes away. And we also want to make sure that we're not damaging important parts of the brain that could be important for producing speech or for example, sensation, providing sensation feeling, or for providing power, causing weakness. So we use the MR scans that we get when the person is in the machine to highlight or to pinpoint the exact target that we want to ablate or destroy to get rid of the tremor. And we use the feedback we get from the awake patient, both in terms of the symptom improvement and in terms of the lack of side effects to make sure they're in the right spot. Typically, the treatment itself takes about an hour. There's a bit of preparation before, and then after the treatment, the frame is removed, and it's really quite gratifying to see the difference when somebody who couldn't drink from a glass of water or could drink with difficulty now is able to drink, all without having to perform a traditional surgical operation without a single drop of blood, which is great. Most patients are able to be treated as day cases, by which we mean that you come in to the MR Guided Focused Ultrasound suite on the day of the surgery and you leave on the day of the surgery. In fact, if you come first thing in the morning, you're likely to be ready to go by lunchtime. We do advise people to be a little bit cautious on the first day or two after surgery, in fact, maybe even the first few weeks, because your balance can be slightly affected, and it may be a good thing to use a stick or a walking frame for a few days or weeks, especially if you already have some problems with balance before the surgery to avoid any major falls. And we review people the day after to make sure that the tremor really has gone, and we often obtain an MRI scan to look at the lesion on another MRI scan on the day after surgery. And we typically like to speak to people, give them a telephone conversation a week, a month, 3 months, and then perhaps see them in person 6 months after the surgery to answer any questions they may have. As I say, it's a really gratifying experience to be able to help in such a meaningful way without having to take a scalpel in hand.